Hi, my name is Todd Brown, and I want to welcome you to this special presentation of headache and neck pain relief secrets. I'll be your host for the next 20 minutes. What you're about to discover on this DVD is how to quickly experience freedom from your headache or neck pain so you can finally live life without an aching head or neck. Please keep in mind, headache and neck pain is commonly mistreated by a lot of physicians and is a potentially dangerous condition millions of Americans suffer from every single year. Ineffective and unsuccessful treatment of headaches and neck pain can quickly lead to decreased levels of activity, chronic discomfort, mood swings, and an overall deterioration of one's health and quality of life. Thankfully, with this DVD, you'll never have to experience any of that. Instead, in the next 20 minutes, you're going to discover a number of the secrets to quickly and permanently eliminating your headache and neck pain naturally, including why going to your family doctor for your headache or neck pain is one of the most dangerous things you can do, how taking pain medications may provide short-term relief but will cost you your long-term health, what you can do right now to free yourself for good from your nagging headache and neck pain. And best of all, at the end of this DVD, you'll discover the ultimate solution that will not only relieve you of your headache and neck pain in a completely natural way without the risk of any nasty side effects, but will let you experience that relief with zero expense. Sound pretty amazing? Well, it is. And you're about to find out exactly why. Let me ask you, do you ever find yourself asking any of these questions? Are my headaches ever going to stop so I can feel good again? What will my life be like if my headache and neck pain never go away? What if my headaches never get better and only get worse? It's completely natural and normal to find yourself asking these types of questions when you're suffering with headaches and neck pain. And it's also quite normal for the fear of the answers to leave you feeling somewhat depressed or even angry. But it's so important for you to understand that you are not alone in your struggle. According to popular medical journals, 9 out of 10 Americans suffer from headaches. Some are occasional, some frequent, some are dull and throbbing, and some cause debilitating pain and nausea. Although headaches vary in kind from sinus and tension headaches to cluster and migraine headaches, the dreadful consequences are all the same. Unlike most other injuries or ailments, because they are located near your brain, headaches and neck pain can cripple your ability to think and damage or destroy every aspect of your life. Here's a question for you. What do you think is one of the most common causes of missed work time? The answer? Headaches. It's the top reason people head home early and aren't able to perform as well on the job as they usually do. And let me ask you, how have your headaches and neck pain been affecting your relationships and your personal life? Headaches and neck pain create anxiety, stress, and even anger. The inability to enjoy the things you usually do with friends and family, like going to a movie, being intimate with your spouse, or even just enjoying dinner at a restaurant, all become a hardship. And a bad string of headaches or neck pain can completely ruin a trip or relaxing vacation. It becomes difficult, if not impossible, to focus on other people's needs when your head and neck are in so much pain. Simply put, when you cannot do the things you normally do, perform the work you usually perform, uphold the responsibilities you usually uphold, it's very easy to start feeling bad about who you are. And let me ask you, how are headaches and neck pain affecting your sleep? When you're in pain and under heightened stress, sleep can be your one and only savior. Your one opportunity to recoup from the hardship of the day and face the morning anew. However, many headache and neck pain sufferers are denied this luxury. Laying flat for an extended period of time can further aggravate the pain. And you might already know for yourself, there's nothing worse than waking up in the middle of the night in so much throbbing pain that you can't fall back to sleep. Poor job performance, a deteriorated personal life, an inability to focus and think, and a lack of sleep. It's no wonder that chronic headache sufferers become easy targets for depression. The combination of all these difficulties can easily make anyone feel as if their life is falling apart. Most depressing of all is the fear of, what if my headaches and neck pain never get better? What if they only get worse? Well, whether you've only just begun to experience headaches and neck pain, or you've been suffering for years, chances are you would not be watching this DVD if your condition was not impacting your life to some degree. At this point, you may have already tried getting some relief from some over-the-counter painkillers, or maybe you've tried regular warm compresses or even massage. The bottom line is, you're probably still in pain and you want a solution. Maybe you're considering going to a doctor, or maybe you already have seen a doctor. Well, here's a word of warning for you. Before you step foot into your doctor's office again, or for the first time, it's critical you hear the truth about the allopathic medical road of treatment for headaches and neck pain. You may be shocked and possibly even outraged by what you're about to hear. Please remember, these are not the opinions of the creators of this DVD, but the publicly documented findings of independent scientific studies and medical organizations. Simply stated, conventional medical doctors are trained to treat your aches, pains, and sicknesses in generally one of two ways: through the prescription of various medications, or in some serious cases, through surgery. It's no big secret. However, did you know medical doctors do not receive any training specifically for treating headaches or neck pain? In fact, let's take a close look at what conventional medicine has to offer you if you choose to visit your medical doctor in hopes of finding headache and neck pain relief. Did you know that each year in the United States, an estimated 140,000 people die from drug-related reactions they get after taking a prescription medication prescribed by their doctor? It's estimated that up to 98,000 Americans die yearly from medical errors. For instance, a doctor accidentally making the wrong incision, a nurse administering the wrong medication, and so on. That's almost 250,000 deaths each year in the United States alone due to the adverse effects of surgery and drug treatment. It's certainly good reason to start questioning what we learned as kids about running straight to the doctor, right? Well, if you go to the doctor for your headaches and neck pain, unfortunately he or she will have nothing else to do other than reach for their prescription pad and offer you drugs. And you can place your bet your doctor's going to recommend or prescribe one of the following types of medications. 1. Over-the-counter painkillers like Tylenol, Advil, or Motrin. 2. Prescription painkillers like Percocet, Vicodin, or oxycodone. Or 3. Prescription muscle relaxers. Let's first talk about the scary truth about over-the-counter painkillers. While these medications can be fairly safe over the short term, it's only when they're taken in amounts not exceeding the recommended dosage and for a short period of time. The problem is, due to the chronic nature of headaches and neck pain, it's almost impossible for a doctor to provide you relief while sticking to these usage guidelines. Fact is, you would not be watching this DVD if you or someone you knew just had one single headache. Headaches and neck pain come back again and again and will not go away after a couple of days or a week in some instances. In fact, chronic headaches and neck pain will never go away until the underlying cause of your pain is remedied. In other words, taking over-the-counter painkillers is a temporary band-aid that will never permanently eliminate your headaches and neck pain. Now, you might be wondering, what's the big deal about taking a little extra Tylenol for a few weeks or even months? I mean, I can buy it at the supermarket. It can't be that dangerous. Well, a breaking new medical study done confirms the health risks and dangers of over-the-counter painkillers. Ulcers and intestinal damage were only some of the common side effects seen in people using over-the-counter painkillers for too long or in too high of dosages. So, if your doctor tells you to just rest up a bit and take some Tylenol for the pain, and he advises you to do this for any length of time more than about a week, or if the recommended dosage exceeds the restrictions on the bottle, don't do it. You will undoubtedly damage and possibly even severely injure your stomach.
Again, even the manufacturers admit on the bottle's labels, these medications are not meant to be taken in large dosages or for extended periods of time. Regrettably, the majority of the medical community chooses to ignore the risks, and they don't admit the dangers these various medications pose to your health until the damage is already done. There is some good news, though. The FDA is finally beginning to do some studies to find out the risks over-the-counter painkillers pose to chronic pain sufferers like yourself with your headaches and neck pain. The FDA found when taken for long periods of time, Aleve and Naprosyn, two of the most popular over-the-counter painkillers, may actually increase the risk of cardiovascular disease. And we haven't even talked about the potential liver damage that results when taking these drugs for a period of time beyond that indicated on the label. Point being, if you have seen or see a doctor who recommends you take over-the-counter painkillers in any amount or length of time exceeding the FDA advertisement, turn and run. Do you really want to suffer decreased cardiovascular health, ulcers, and a toxic liver in addition to your headaches and neck pain? I think not. Now, what if instead of recommending over-the-counter painkillers, your doctor chooses to prescribe a narcotic painkiller for your headaches and neck pain? These drugs are different from aspirin and Tylenol and whatnot because they are derived from opiates. What does this mean? You guessed it. In addition to the many other health risks, these drugs are highly addictive. You might recognize these substances by their more common names. Perhaps your doctor has already prescribed one of these for your headaches or neck pain. Percocet, Vicodin, codeine, oxycodone. Do these drugs work? Absolutely, if your definition of working is to provide relief from severe or chronic pain. However, each and every time you take one of these drugs to relieve your headaches or neck pain, your body develops a greater tolerance. For this class of drug to continue working, you're required to take higher and higher doses. Keep in mind, this class of drug is a derivative of opiate, the same substance used to make heroin. I know it sounds crazy, but it's the truth. Taking these drugs for headaches or neck pain is a surefire way to dependence and addiction. Not to mention the agony of withdrawal symptoms when you attempt to stop these drugs can be pretty brutal on the body. Whether your doctor prescribes a narcotic or non-narcotic painkiller for your headaches or neck pain, the critical problem is this. None of these medications actually fix or heal the cause of your headaches and neck pain. Therefore, as the pain persists, if you do not seek other help, you must take these drugs in higher dosages to function. In your quest to be free of headaches and neck pain, you must be careful not to compromise and endanger your short and long-term health. This is critical. Now, some doctors stay away from painkillers with their headache and neck pain patients and instead prescribe muscle relaxants. The problem here is that muscle relaxants don't get to the root of your pain and only force the muscles in your neck to loosen up. Meanwhile, the tight muscles are the body's way of protecting further damage to your body. When your head or neck starts to hurt, it's because you've been maybe staring at the computer screen too long or maybe holding the phone wedged into your neck for too long. Pain is your body's way of telling you to stop what you're doing because you're potentially going to wound your body. By taking muscle relaxants, you're essentially telling your body to be quiet. That's why most people who stop taking muscle relaxants find their neck is even more severely injured and their headaches are even worse than before. This is not something to take lightly. To make matters worse, the side effects of muscle relaxants are extreme, to say the least. Reports show up to 70% of individuals who take muscle relaxants suffer from drowsiness or dizziness. How's that sound? Temporarily stop your headaches and instead feel drowsy and dizzy. Not only that, but there is a likelihood of addiction after as little as 1 week of regular use. Talk about dangerous. If you choose to seek help from your medical doctor, more specifically for your neck pain, there's one last treatment he may prescribe. It's not a drug in the sense that it's a pill, but it is a medication. In fact, it's one of the most frightening treatments of all. Welcome to the world of epidural steroid injections. This is a common choice for treatment of neck pain by a lot of medical doctors. Here's how it works in a nutshell. In an attempt to reduce neck pain and inflammation, pain doctors use an X-ray guided injection of steroids directly into your spine. Does that sound fun? Does it sound dangerous? Well, the PDR, the guidebook doctors are supposed to follow when prescribing medications, specifically states, quote, suitable joints for intra-articular injection are the knee, ankle, wrist, elbow, shoulder, phalangeal, and hip joints. Joints not suitable for injection are those that are anatomically inaccessible, such as the spinal joints, unquote. Again, joints not suitable for injection include spinal joints. If you're bold enough to ask your doctor whether or not the PDR approves of the large needle he wants to stick into your spine to help your headaches and neck pain, don't expect a straight answer. If your doctor admits anything at all, he'll probably say the PDR is just being overly cautious and he's injected hundreds of spines without any complaints. Ask him why is it then that epidural steroid injections have been banned in several countries around the world. You don't have to be a brain surgeon to realize injecting a syringe directly into your spine is not a safe or natural way to relieve headaches or neck pain. An epidural injection delivers steroids directly into the very thin epidural space in the spine via a very long needle. And according to studies, quote, blind needle injection, even by skilled and experienced professionals, has been found to be inaccurate 25 to 30% of cases, unquote. That means if a pain doctor wants to give you just one single epidural injection, just to see if it helps your neck pain or headaches, you have a 1 in 4 chance of becoming victim of an inaccurate injection. And that's if he's a skilled and experienced professional. So, what's the big deal about haphazard, inaccurate injections to your spine? Just ask Dennis Capolongo. A nagging hip pain prompted Dennis to visit his medical doctor. After receiving just 2 epidural injections, he suffered 2 trips to the hospital, was hospitalized, and suffered non-stop back pain. That's not even the real tragedy. Dennis developed arachnoiditis, a pain disorder caused by the inflammation of the arachnoid. That's one of the membranes that can easily be damaged as a result of blind epidural injections. He can no longer work or do anything he used to because of his condition. He describes the condition as, quote, sheer, hopeless hell, unquote. And there is no cure. Dennis invests the little strength he has warning unknowing patients like yourself of the horrific dangers of epidural injections. Does this form of treatment sound like something you should gamble on? I think not. Now, let's just recap everything you've learned so far about the only drugs your doctor can prescribe for your neck pain or headaches. Over-the-counter painkillers, which have been proven to erode the stomach, cause ulcers, and turn your liver toxic. Prescription painkillers, which also inevitably lead to dependence and addiction. Muscle relaxants, which will mask your pain while you do even greater damage to your head and neck. And finally, the epidural spinal injections, which can leave you terminally sick, paralyzed, or worse. I hope you see that none of these are a wise choice to eliminate your headaches and neck pain. Now, if you walk away with one and only one thing from watching this DVD, and we certainly hope you walk away with much more, understand this. Nobody is questioning how horrible and debilitating your headaches and neck pain are, and nobody is saying you should have to live with them. However, medications and surgery will not provide you the headache relief and restoration of your head and neck health that you want and need to return to your normal life. It's not all that complicated. Medical doctors are not trained to treat your headaches and neck pain. That's why they just prescribe medications or refer you to other specialists who will either prescribe harsher medications or even recommend surgery. The most you can hope for when going to a medical doctor is a little bit of short-term relief. Now, at this point, you may be thinking that it might be best to just rest up and hope your headaches and neck pain go away. Maybe that's what you've been trying to do so far. In fact, if your medical doctor is a bit more conservative, he might have even advised you to rest up until you feel better. Certainly, rest is a good medicine when you're in any kind of pain. However, unlike a sprained wrist that you can just rest for a few days and it will probably feel better as long as you're careful about not placing additional stress on it, headaches and neck pain are far more complicated. Your work, family, chores, diet, and even your bed all contribute to your headaches and neck pain. Once you're done resting, you can't very well continue to avoid them, can you? Until you correct the cause of your headaches and neck pain, they will keep coming back. So, if you've been thinking about just laying in bed until your pain goes away, think again. You're only delaying the inevitable. So, here's the million-dollar question. If medication and rest cannot help you, what can? What in the world is going to permanently relieve you of your chronic headaches and neck pain? Well, there's a very exciting answer to that question. But let me first ask you this. What if there was a solution that would remedy the cause of your headaches and neck pain without any risks or nasty side effects and would restore your body to normal health? And what if this headache and neck pain remedy was completely natural and you could begin to experience the relief completely free of charge? Well, hold on tight as we take a quick trip back in time to uncover a little known and even lesser understood secret about the true path to headache and neck pain relief. Dating back thousands of years, early-age doctors in ancient Greece, Rome, India, and the Orient studied and practiced relieving pain and restoring health by resetting the alignment of the spine to its natural state. Over the centuries, with the advancement of technology and modern medicine, this method of healing the body has continued to evolve and advance. Yet, it remains grounded on the same ancient wisdom that if you heal the spine, you can heal the body. Unlike modern medicine with its constant discontinuation of surgical procedures once thought to be safe and recall medications now known to actually harm you, this healing process has absolutely withstood the test of time. It remains the only way to relieve your headaches and neck pain and restore your health naturally, without any medications, surgery, or risk of nasty side effects. The relief and remedy you seek can only be found in the little known and commonly misunderstood world of chiropractic care. If you've heard about chiropractic before, it's a good bet what you've heard is false or inaccurate. Most of the talk about chiropractic care is based on hearsay or senseless jokes about how they crack and snap your spine. Well, this couldn't be any further from the truth. You see, the word chiropractic is of Greek origin and simply means treatment by hand. While modern medicine is fraught with nightmarish tales of surgeries gone wrong and untested drugs which get recalled only after the damage is done, chiropractic care is a successful drug-free, hands-on treatment for headaches and neck pain that has persisted for over 5,000 years. Chiropractic health care is a form of medical care which emphasizes the natural recuperative power of your body to heal itself without drugs or surgery. You may be thinking, don't chiropractors just work on your spine? Actually, they work on your nervous system by treating your spine. And since your nervous system controls all of your body's organs and tissues, a well-functioning, clear-communicating nervous system allows your body to properly recover from ailments causing pain, like your headaches and neck pain. In other words, chiropractic care will allow your body to naturally recover from the root cause of your headaches and neck pain, and will allow you to finally feel good. Now, you may have avoided going to a chiropractor in the past because of something you heard from someone you know. These are what we call the chiropractic myths. Let's quickly cover them. Myth number 1, chiropractors are not real doctors. Not only are they real doctors, but it actually takes 7 years of school in a curriculum similar to a medical doctor's training to complete their schooling. And in order to earn their license to practice, chiropractors must then successfully pass a state and national board examination in the very same way MDs are required to. Myth number 2, chiropractic treatments hurt. This couldn't be further from the truth. Most chiropractic patients find chiropractic adjustments very relieving. The mild pops some patients report hearing while being adjusted is just the natural release of gas bubbles that have become trapped in the joint. It's the same as when someone cracks their knuckles. The loudness of the sound varies from patient to patient and has very little to no meaning. Myth number 3. Once you go to a chiropractor, you have to keep going forever. Although many choose to continue their chiropractic visits simply because of the incredible health and vitality chiropractic care brings them, some patients are able to experience lifelong benefits from just a few weeks of treatment. Myth number 4. Chiropractic care is not safe. This is the biggest myth of them all and one that is misleading thousands and thousands of people. Since chiropractic medicine seeks to restore your body to its natural state of health, unlike allopathic medicine, chiropractic is recognized as one of the safest types of healthcare in the world. It does not include any of the nasty side effects or risks associated with drug therapy or surgery. In comparison to allopathic medicine, which uses drugs and surgery as the core form of treatment for headaches and neck pain, chiropractic presents far less risk. This is why chiropractors enjoy the lowest malpractice rates in the entire field of medicine. Even the insurance companies have been forced to admit there is no safer care for you and your head and neck pain than chiropractic care. In a recent study done at Duke University, researchers discovered that patients with tension headaches experienced the same short-term relief with chiropractic care as they did with drugs. However, unlike chiropractic, the drugs caused an adverse reaction in 82% of the patients. That's more than 8 out of 10 patients experiencing adverse reactions. The most amazing discovery was what happened after the study. The patients who were taking drugs for their headaches returned to the same state as before. But the patients who received chiropractic care reported fewer and less severe headaches long after they stopped treatment. Now, you may already know someone who's experienced the life-changing relief of chiropractic care. You may also know someone who's gone for a single chiropractic treatment and claimed it didn't work. Well, here's the sad truth. In today's fast food society, most people opt for the convenience of popping a pill rather than getting the treatment they need to be permanently healed so they can experience long-term headache and neck pain relief. Many give chiropractic a try but are simply too stubborn and depressed to believe their pain will ever be relieved without drugs or surgery. Still, others are so reluctant to try something new that doesn't stick to what the medical doctors have told them that they delay getting help so long that by the time they arrive at the chiropractor, their condition is virtually untreatable. Regrettably, it's not uncommon for other headache and neck pain sufferers to find themselves thinking or saying these exact things about chiropractic care because they simply do not understand it. You may have even had very similar opinions before watching this DVD. But now you've taken the time to get educated and informed about the secret of headache and neck pain relief, and that is quite admirable. You now know the truth about the commonly accepted but highly ineffective and dangerous headache and neck pain treatments medical doctors will offer you versus the completely natural, safe, and highly effective care you're going to receive from a chiropractor. At this point, you're probably eager to discover exactly how chiropractic care can help you and your aching head and neck. Or maybe you're hopeful but still a little hesitant. The great news is there's no need for you to worry or take any risks. Discovering how chiropractic care can help you is fast, easy, and best of all, free. Now, we'll get to the free part in a moment. First things first, you might be wondering, do you need a referral from an MD to get a chiropractic treatment? Well, the answer is no. You do not need a referral from your family doctor or primary care physician before visiting a chiropractor. In fact, what most people don't know is that federal and state regulations view chiropractors as a first contact physician. In other words, they are primary care physicians. You might also be thinking, but isn't chiropractic care expensive over the long haul? Well, the answer is no. The majority of all insured American workers have coverage for chiropractic care, and that percentage is increasing regularly. In addition, most doctors offer affordable payment plans to accommodate those who are not covered. If you happen to have to pay out of pocket, you can rest assured you'll still be saving a lot of money over the alternative. But we want to make it as easy as possible for you to experience the secret of headache and neck pain relief with chiropractic care. Inside the package that came with this DVD, you'll find a written letter inviting you to receive a chiropractic headache and neck pain relief consultation absolutely free of charge with no strings attached. We don't think your pain is in your head or that you're exaggerating, and we definitely don't think that headaches and neck pain are something you should learn to live with or that you need to live with. No way. That's why we want to give you the opportunity to quickly and easily discover how you can experience the headache and neck pain relief you desire with chiropractic care. However, there is one essential requirement you must meet. You must have an open mind. We're more than happy to answer all the questions you may want to ask when you visit. I mean, that's what educated people like yourself do. And that's why we've created this DVD for you. However, at the end of the day, you must be prepared to give chiropractic care a real chance, to listen to the guidance and wisdom of your chiropractic doctor. Without an open mind and willingness to comply, chiropractic care cannot help you. You're now faced with a choice. You can choose to continue suffering with your headaches and neck pain, to continue suffering the negative impact of headaches and neck pain on your work, your relationships, and a general inability to enjoy life the way you usually do. To listen to well-meaning but misguided medical doctors who want to provide you momentary relief from headaches and neck pain with dangerous medications, jeopardizing your long-term health. And to listen to your supportive friends and family who mean well, who have also been lied to about painkillers being an acceptable way of life and a cure-all solution. Or you can contact our office right now. Tell us you want to take advantage of your free headache and neck pain relief consultation. During your visit, you'll discover exactly how you can begin experiencing the permanent pain relief you so desire and how you can return to your normal life. There's absolutely no risk or obligation to you. Now, you might be wondering why we would take time out of our busy schedules to see someone like yourself and not charge you a dime. Simply stated, we absolutely believe in the headache and neck pain relief we can provide you, and we're confident after meeting us and experiencing it yourself, you will too. Take a look at the letter that came with your DVD and give us a call now. Just say you're calling for your free headache and neck pain relief consultation, and we'll take care of the rest. The only thing you'll have to do then is prepare yourself to experience the true secret of headache and neck pain relief and start making plans for what you'll do when you're finally feeling terrific again. Don't wait until your headaches or neck pain get even worse. Call now. The secret to your headache and neck pain relief is waiting for you.